Hello everybody, my name is Jeremy Marquis and today I'm going to be talking to you guys about Alprazolam. So a little overview of Alprazolam. It's more commonly known as Xanax. Alprazolam is its generic name. Some street names for Xanax include terms like bars, beans, fries, Xans, hulks, ladders, Xannies, and multiple other terms. It's a CNS depressant, central nervous system depressant, and it's classified as a benzodiazepine. It's primarily used as a treatment for GAD, which is generalized anxiety disorder, and panic disorder. However, additionally, we do see that it is prescribed as a form of treatment for alcohol withdrawal and people who have difficulty sleeping. It came to popularity back in the 50s and the 60s as a means to replace its dangerous predecessor, barbiturates. Commonly comes in pill form, but it can also come in oral solution as well. And the most common type of pill forms vary in dosages from 0.25 milligrams all the way up to 2 milligram bars. So on the bottom image, there is the 2 milligram bar, and it semi-resembles a ladder, and that's where one of its street names comes from. It's classified as a Schedule 4 substance, meaning that it has low risk of dependence and abuse. However, we do see that it's a very commonly abused drug in society. So some of the pharmacology behind Alprazolam is it works by specifically targeting neurons that have receptors for GABA, which is gamma-aminobutyric acid, and by affecting these neurons with this receptor, we see decreased activity in the neuronal network throughout the brain. So there's a reduced action potential within these neurons. That means that it doesn't excite the areas surrounding it, and just overall decreased activity within the brain. These effects are more predominantly seen in the limbic system, reticular activating system, and the motor cortex, and this chemical interaction results in mood alteration, drowsiness, and muscle relaxation. There are very profound effects of this substance. As we see in some patients, they have half-lives of up to 15 hours, and about 80% of this drug reaches the action site, which is part of the reason why it has such a profound effect on people. Substance peaks after about 1 to 2 hours in the system and is mainly metabolized by the liver. Some of the physical effects of this drug include things like slurred speech, blurred vision, poor motor coordination, and excessive tiredness. Some side effects of taking this drug is it can cause drowsiness, lightheadedness, diminished libido, depression, nausea, vomiting, constipation, insomnia, confusion, diarrhea, tachycardia, congestion, blurred vision, as well as an inability to recall events. Severe withdrawal symptoms as well. In short-term users, we do see that some of them will exhibit anxiety and insomnia, and typically they are prescribed this medication to treat those two disorders. And then in long-term users, their withdrawals can be a little bit more severe and can include symptoms like depression, panic, paranoia, convulsions, as well as death if they are not properly weaned off of the substance. For people who are using, it can take up to a month to be completely rid of their withdrawal symptoms, and this is typically seen in people who have been heavy frequent users for months to years, but however, we can see symptoms of people who have only used it for a short period of time develop dependence. Some dangers and risks associated with Xanax use is the interactions with alcohol can be extremely lethal, and it's a very common practice amongst people who abuse this substance. They're commonly used together, and this results in a synergistic effect. The effects of these two substances result in more profound sedation of the central nervous system, and this typically this can result in an overdose if used in too high of quantities. We also see adverse effects on cardiovascular and respiratory systems, and an increased potential for becoming unconscious or comatose, liver and kidney damage, risk of psychosis, development of physical dependence, and development of substance use disorder. Because of recall inhibiting properties, it is commonly used in sexual assaults, and due to higher levels of sedation, the rates for a comatose type state of this drug is commonly used in date rape assaults, and it makes it harder for the victim to identify any events that occurred during the night. And it also has a very high addiction potential for the users, and it is a high risk for abuse substance. Thank you guys so much. Hope you have a good day.